Hello, everyone, and we want to welcome members of the California Latino Legislative Caucus and all of our panelists and you, the public as well, to this online informational briefing hosted by the legislature's Latino Caucus on the subject of COVID-19 and the Latino community and the heavy toll of health and workplace inequities. From the state capitol here in Sacramento, I am Brian Green. And as you know, the COVID-19 pandemic of 2020 has revealed and further magnified the deep and sobering disparities in treatment and healthcare access, salary, security, etc. for the Latino community, the essential worker community in the fields, working in the hospitals, the hotels, the packing plants. But the pandemic has put them at greater risk of COVID without equal access to protection. And that is, of course, part of definitely what we'll be talking about in this 2-hour briefing. This will be a 2-hour briefing with 3 panels, the agenda of which, for you and the public, if you're interested, can be accessed on the Latino Caucus webpage and on the Caucus Facebook page. And any PowerPoint presentations used, and you will see a couple of them here, and any resource materials that are referenced during this briefing can also be found on the Latino Caucus's website and webpage. Shortly, we're going to hear some opening remarks from Latino Caucus senators and assembly members. And following those opening remarks, we'll begin with the first panel, which will last approximately 20 minutes. Each panelist through this briefing will have up to about 5 minutes for remarks, and the remaining time after remarks will be used for questions for the panelists from the members of the Latino Caucus. And members who are with us, we're really glad to have you. Just to clarify some logistics, if you do have a question for any of the panelists at the conclusion of their respective presentations or remarks, I can't guarantee that I'm going to see everybody here on the Zoom screen, and I don't want to miss anybody, so I'll just say be assertive and take yourself off mute. That's a key thing we've all learned over the last several months. And just open up with your question, assert yourself, and get right in with your question. I just don't want to have people raising hands and I can't see them and then they don't get heard. So that'll be our order of the day in terms of taking questions. And to assure all questions are addressed, we're going to ask respectfully all legislator panelists to keep their remarks or their questions as brief as possible. And once we have hit that time limit of 20 minutes for each panel, we'll move on at a natural point to the next panel. And if members of the public who are watching and who would like to offer their own testimonials or share pertinent information with the members of the Latino Caucus, you're invited to email your comments or questions or any other information you have to the Latino Caucus at latino.caucus@sen.ca.gov. That's our housekeeping for this briefing, and with that, it is a pleasure to welcome the new chair of the Latino Legislative Caucus, representing the 24th Senate District in Los Angeles, the Honorable Senator Maria Elena Durazo. Senator Durazo, good to see you. Welcome.
Thank you, Brian. Appreciate you. Thank you for taking the role of moderating.
My pleasure.
As you said, I represent District 24, Los Angeles and East LA, and on behalf of everyone in the Latino Caucus, welcome you to this briefing. And thank you to the panelists. Thank you to everyone who's going to make a presentation. And also thankful of the caucus members who are here today, including our Vice Chair, Assembly Member Robert Rivas. Before they make some remarks, I also want to thank the administration, the governor, for working hard to address a very unprecedented, actually, world health crisis. COVID-19 has brought tragic levels of death, illness, and economic pain to all of our cities and families. Thousands have been stricken, and the death toll increases every single day. Though Latinos only account for almost 39% of our state's population, they account for 60% of the cases and almost 49% of all deaths. That equates to 442,000 cases and almost 9,000 deaths. They include Latinos of all ages and backgrounds, essential workers who harvest our food, keep our groceries on the shelves, address our medical needs, and undocumented residents who battle to stay healthy and meet their financial needs without anywhere near sufficient assistance from our government. Though we know the pandemic has hit the Latino community the hardest, the question is why? I hope today's briefing will not only educate us on the why, but more importantly, what can and what should the legislature and the administration do to address the factors contributing to these health and economic disparities. Now, let me ask our Vice Chair, Assembly Member Robert Rivas to say a few words. And after Assembly Member Robert Rivas, I'd like to ask the other caucus members to also make some remarks. Robert.
Thank you so much, Madam Chair, and a good morning to everyone. I want to welcome everyone to this very, very important a discussion on Latinos and COVID-19. So I represent the 30th Assembly District. I'm very, very proud to serve as the Vice Chair of the California Latino Legislative Caucus. And I want to start by thanking our Chair, Senator Maria Elena Durazo, and our Latino Caucus for bringing together experts and state leaders to further inform us about this Latino experience amid this pandemic. The data, research, facts, they're critical. They're critical to informing our legislative response to this, to the unprecedented issues that COVID-19 has prompted. And this is personal to many of us, as many of our caucus members represent predominantly Latino regions, districts. And as we know, Latinos who largely make up our essential workforce here in California have been disproportionately hit by the health and economic challenges of COVID-19 in this pandemic. The data speaks for itself. The largest county in the district I represent, the County of Monterey, Latinos account for 61% of the total population, but represent a staggering 93% of confirmed COVID-19 cases. With our essential farm workers, our agricultural workers, being 3 times more likely to contract COVID-19 than the general population in the County of Monterey. It's a problem. Statewide, we know that Latino deaths have quintupled since May of this year, because of their status as unsung essential workers. We as a state, we can't allow this to happen. And we as a Latino caucus must do everything we absolutely can to address these inequities at the state level and in every region of the state of California. I look forward to this productive conversation and the necessary follow-up to address these disparities. And again, thank you and welcome to our participants and to our members.
If we could have the other members of the caucus, Assembly Member Gonzales.
I'm obviously just here to listen to this very important discussion and see what we can do to help support the efforts of the leadership of the Latino Caucus and all the groups who are working on this important issue.
Thank you. Assembly Member Luz Rivas, are you still on and connected? Okay. All right, we'll catch up later. Okay, Mr. Bryan, I think we could move on.
Okay. Thank you, Senator. Thank you, Assemblymember Rivas and Ms. Gonzales. We'll now proceed with the first of our 3 panels. The first panel is titled Latino Health Disparities, a Deadly Confluence of Factors. And I'm very proud to introduce for this panel Dr. David Hayes Bautista, UCLA Professor of Medicine and Director of the Center for the Study of Latino Health and Culture, and also Ana Padilla, who is the Executive Director for UC Merced's Community and Labor Center. And we will begin with Dr. David Hayes Bautista. Dr. Hayes Bautista, welcome. Look forward to your presentation.
Thank you. It'll be a pleasure. Let me just share my screen as we're all becoming Zoom expert these days.
Yes.
So we're going to be talking about COVID-19 and Latino health. And here it is, 9 months of the pandemic in one chart. We have the number of deaths, total number of deaths, clearly affecting the older Latinos, 80 and older, 65 to 79, 50 to 64, right, prime working age, but also younger age group Latinos. Now the question is, why should anyone care? Why should non-Latinos care if Latinos are dying? Democrats, Republicans, Independents, Greens, why should anyone care? Well, because this affects our economy, the US economy, the state's economy, the California economy. We just released about 8 weeks ago our Latino U.S. Latino Gross Domestic Product Report, the GDP report. Most of you should have a copy. If not, contact me. I'll make sure you get a copy. To make a long story short, the 60 million Latinos in the United States produced the world's 8th largest economy. We are a big dog economy. We're right there in the top 10. Bigger than Italy, bigger than Brazil, bigger than South Korea, bigger than Russia, bigger than almost anybody else. Well, except, of course, India, France, UK, Germany, Japan, China, US, and of course, we're part of the US. Most importantly, however, is the growth rate. For the 8 years between 2010 and 2018, the US Latino GDP had the 3rd fastest growth rate of those top 10 economies, and in fact, about 50% higher than the US GDP. We are the growth spot. We are potentially the part that can power us into this post-COVID recovery. However, the very things that Latino do that help us create the world's 8th largest economy are being attacked by the coronavirus, such as, for example, the very strong work ethic that we've demonstrated in California for nearly 80 years. And here we see in GDP terms from 2005 to 2018, the yellow columns are the percent of Latinos in the workforce. And you notice in every year, compared to non-Latinos, or this blue line, Latinos have a higher labor force participation. In fact, while the blue line has been dropping, Latino labor force participation has actually been growing. There's now nearly a 6 percentage point premium. Thanks to Latinos, we are 6% more likely to be in the labor force. However, we tend to be in the occupations and in the industries that rarely provide personal protective equipment, that require that Latinos stand shoulder to shoulder, work in crowded situations. That means they're more exposed to the coronavirus, thus the higher case and death rate. We are also very family oriented. Latino households are larger than anybody else's. We tend to have more wage earners per household than anybody else. And we tend to have more children. And we see here the rate of household growth, which is an important driving factor for the gross domestic product. Again, in yellow, the Latino year-on-year percentage growth in households, and in blue lines, non-Latinos. Latinos are creating new households at 6 times the rate of anybody else. However, because we have more people, coronavirus loves this, and so it's attacking Latino households. And it doesn't help that Latinos are more likely to be uninsured. Even after Obamacare, Latinos were about twice as likely as other populations not to have insurance. And of course, some industries, some occupations, such as farm worker, packing houses, et cetera, rarely offer insurance. The low wages. You know, the problem is not that Latinos don't have jobs. Latinos have jobs. The problem is we just simply don't pay them. So that a lot of Latinos can work 2 and 3 jobs and not even make minimum wage. So it's not the lack of jobs or work ethic, it's the lack of payment. And of course, add to that then the Latino provider shortage, something we've been studying for nearly 40 years. To make a long story short, there are very few Latino physicians in the state of California. And if you're looking for one who speaks Spanish, even fewer. And before people jump on that and say, well, so what? We have to remember that medical services have been provided in Spanish in California for 251 years. So the use of services in Spanish is nothing new. It's part of California history. And then, of course, we've had 5 years of this virulently anti-Latino narrative, which in terms of COVID is blaming Latinos for the coronavirus pandemic here in the United States. Stop immigration. Well, actually, it turns out that 80% of Latinos in California are U.S. citizens. It varies a little bit by age group, but basically children, young adults, 80 to 90% citizen. Over 65, about close to 80% citizen, but it's in the prime working age that you get the immigrant population. So this is why everyone should be concerned about COVID-19 and its effect, not only on Latino health, but on the U.S. economy. Just a couple of days ago, the Pew Foundation came out with an analysis that I think we're all seeing, that Biden carried fewer counties, but they were the productive counties. They were the counties that produced 70% of the U.S. GDP. Trump carried the counties that produced only 30%. But everywhere there are Latinos in all parts of the United States, and we are creating have been creating the world's 8th largest economy. We can drive the U.S. economy into the post-pandemic expansion. That's why every one of these deaths should matter to everyone. Every death is one person less able to contribute to the growth of the U.S. economy to our post-pandemic economic recovery. That's why everyone should worry. Thank you very much.
All right, thank you very much, Dr. David Hayes Bautista. Appreciate your presentation. And we'll move on next to Ana Padilla, the Executive Director of the UC Merced Community and Labor Center. Ms. Padilla, welcome, and look forward to your presentation too. And Ms. Padilla, I think you are still on mute. If
All right.
There we go. Welcome, Ms. Padilla. Thank you for joining us.
Thank you. Good morning. My name is Ana Padilla, and I'm the Executive Director of the UC Merced Community Labor Center. I'm joined here by Dr. Edward Flores, also with the center. We would like to open by thanking the chair, co-chair, and the California Latino Caucus for inviting us to speak today on research related to Latinos in the COVID-19 crisis. Today, we will share research that indicates the need for a shift in public discourse on COVID-19 policy. Key findings suggest that, first, the pandemic has led to many more Latino deaths than have been accounted for, especially among immigrants. Second, Latino compliance with public health mandates is no different than that of non-Latinos. Third, stronger enforcement and education around workplace rights and health and safety is vital for mitigating COVID-19 spread. We begin with striking findings. In California, Latinos have experienced a greater increase in pandemic-era deaths than any other group. For Latinos, there were 35.9% more deaths in 2020 than in 2019. The increase of immigrant Latino deaths has been double that of native-born Latinos, despite research showing that the health of immigrant Latinos is actually average. This suggests greater factors driving COVID-19 deaths than underlying health disparities. 14 counties experienced an over 50% increase in immigrant Latino deaths, including Los Angeles and Riverside. Kings County experienced an over 450% increase in immigrant Latino deaths. Many efforts for mitigating the COVID-19 crisis have assumed these disparities are a result of lack of education. And so public health mandates have focused on individual level behavior, such as wearing masks, avoiding crowds, and social distancing. UC Merced research, however, has found no evidence that Latinos do not follow individual level public health mandates. Rather, we find that many Latinos are financially vulnerable and work in environments that are not conducive to public health mandates. Our Fresno Speaks studies examined nearly 2,400 Fresno residents' experiences with COVID and individual level compliance with public health mandates. We found Latinos' compliance with public health mandates was the same as that of other groups, between 86 and 92%. In addition, researchers affiliated with our center found that rural immigrant Latinos experienced financial insecurity, worked in environments with unsafe practices, and said they did not speak out due to fear of retaliation. Latinos experience a large proportion of low-wage, food chain, frontline essential jobs, including a majority of jobs in agriculture and food processing. Agriculture and food processing workers have a uniquely disadvantaged profile. Agriculture and food processing workers have high rates of being immigrant, non-citizen, earning low wages, and living in large or multiple family households. The profile of disadvantaged immigrant workers in essential frontline industries leaves them vulnerable to workplace health and safety noncompliance. We see this in meatpacking, which prior to the pandemic had a high concentration of disadvantaged workers and a record of workplace health and safety noncompliance. This is especially true in the Central Valley's meatpacking industry, where half of the state's meatpacking workers live. Our policy brief, Manufacturing Risk, found that between 2015 and 2020, the Central Valley's meatpacking industry has accounted for 2 of every 3 of the state's inspections related to meatpacking accidents, complaints, or whistleblower-related investigations. At the same time, the Central Valley's meatpacking industry has had nearly the lowest rate of violations issued per inspection in the state, suggesting a greater need for enforcement. Non-compliance with workplace health and safety measures has seeded some of the state's largest COVID-19 outbreaks in ag and meatpacking. In early May, an outbreak in Kings County-based Central Valley Meat Company accounted for virtually all of the county's hundreds of COVID-19 cases. Foster Farms Livingston, one of the largest COVID-19 outbreaks in the state, provides another case, highlighting the need for better enforcement and interagency coordination. In April, Merced County Department of Public Health was first notified of multiple COVID-19 cases at Foster Farms. In June, it was declared an outbreak. In July, the county found out that there were 2 deaths and a 40% positivity rate at the facility, which was 8 times the county's 5.3 positivity rate at the time. In August, Osha conducted its first visit. Weeks later, after repeated employer noncompliance, 392 positive cases and 8 worker deaths, they were ordered to shut down. In conclusion, we find, first, California immigrant Latinos have had far greater COVID-19 era increases in death than any other group. Second, California Latino deaths are not due to lack of individual level compliance with public health mandates. Third, industries with low-wage immigrant Latino workers have a long track record of health and safety noncompliance, and such industries are now at greater risk of COVID-19 spread. We recommend, first, education efforts need to focus on workplace-related behaviors such as workplace health and safety education, worker rights trainings, and the use of compliance-related mechanisms. Second, greater enforcement around workplace health and safety standards, as well as interagency collaboration. Thank you.
All right. Thank you very much, Ana Padilla from UC Merced. Lawmakers, members of the Latino Caucus, this will be your opportunity if you have any questions or comments for our 2 panelists on this first panel. And again, I am a bit limited on who I can see on the Zoom screen, so I'll just ask you to be assertive, unmute yourself on your own, and ask any questions or make any comments you have.
Brian?
Yes, go ahead.
Yes, thank you both very, very much. Dr. Hayes Bautista, you've come at this, you've raised some issues that normally we don't talk about, which is, I think, is really great. And that is our economic status. And usually, and coming out of the labor movement, what's happening is the reinforcement of these low wages, unsafe workplaces. So we've come at it from that understanding of our community. We've not come at it from the understanding that we are such a positive force that this state and this country needs to pay attention to us as a positive force, not only as a force that gets hurt by something like the COVID and being uninsured. Absolutely. But I'm curious as to what you think are some of the policies that would address this. How can we raise this in and given more of a profile? Is there anything that as legislators and administration that you think we can and should do?
Quite a bit. I mean, the reason why we chose to focus on doing the Latino GDP is, for decades I've been pointing out about Latino population growth. Nobody cares. Once we put it into a number that people understand, wow, the world's 8th largest economy, suddenly we get their attention. And so we say, now you need to invest so that it's going to grow. Latinos have created the world's 8th largest economy with a lot of lead weights being put in the saddle, lack of health care, low wages, the way we've treated immigrants. Their children, the immigrants' children, are now turning 18. In California, every 4 years, 1 million US-born Latinos will have turned 18, the end of the labor force. Are we investing in their education? Not a whole bunch. Instead, we're making them take out loans. And the baby boomers got educated practically for free, by the way. Are we increasing their access to health care so they can be nice and healthy? Are we facilitating the formation of households, buying of real estate, etc. These are investments that need to be made so that we can actually fully unleash Latino economic potential. I'm convinced that we can quickly bypass a number of countries and wind up being the world's 5th, 6th largest GDP, which is powering the rest. The rest of the US GDP is not growing very well. We are the growth center. We should be seeing as the thing that's giving the US the economic advantage for the next 50 years, not as a problem that needs to be kept out by a wall.
Great. Thank you very much. Thank you. And just a question for Anna. In terms of the policies that you've recommended, are there any distinctions considering the place in the state that you've focused on, the Central Valley? Are there any distinctions with regards to these recommendations? Some of them sound fairly that we could pretty much almost any place apply these recommendations. Are there any particulars with regards to the Central Valley that you would add on to these recommendations because of the industries?
Sure. Senator, the Central Valley agriculture and meatpacking workers really give us a window into how the virus is spreading. What we're learning is that the virus is spreading in occupations where we find disadvantaged workers. Where we find disadvantaged workers, we find workers who are afraid to report workplace health and safety violations, employer noncompliance, and if we want to successfully mitigate the spread of the virus, we need to support and protect workers so that they can come forward to report unsafe working conditions without fear of retaliation. In the Central Valley, or I should say, the Central Valley is home to half of all meatpacking workers. It's home to half of all ag workers. And so I think, targeted enforcement, certainly, industry-specific strategies would be helpful. So I would say that regional, there's some regional aspects to enforcement that we need to address.
Okay. Thank you.
Are there any other lawmakers, members of the Latino Caucus that have any questions or comments for our panelists for our first panel? Feel free to jump on in.
If not, I can send everybody a take-home exam.
This is Senator Ana Avallero. Can you hear me?
Yes, we can, Senator. Welcome.
Great. Thank you so much. I was on from the beginning, but I had the wrong entry. Thank you so much for your information. I'm really looking forward to the rest of the panelists. But I was wondering if part of the challenge in California is the high cost of living, and the high cost of living really drives people to live in overcrowded familial situations. In rural California, you're not going to let your family member live on the streets, and so you'll find a place for them even if it's significantly overcrowded. Did that play into any of the research that you've looked at? And what I'm trying to figure out is if we can reduce some of these densities over the next couple of months in rural California, and is it possible we'll see the reduction in the spread of the infection, because we've hoped to solve one of the big issues, which is that people end up going home, and then if they've contracted the disease, they share it with their families.
Well, if I could just take a first stab, that I'm sure Anna also has some information on that. Probably what we'd want to do is start with the outliers, like the barracks. A lot of farm workers sleep in barracks, driving in overcrowded vehicles. These are the sorts of things that probably would have the biggest impact first. And then we can start to move on to the issue of many people in a single family dwelling. We tend to have multiple families. I mean, across the country, Latinos have more people per household, including more wage earners per household, which means they go out, they work, they become exposed. And even though the kids and the abuelos can be sheltering at home, they're more likely to be exposed because of the multiple wage earners going out and coming back every day. So we need to also look at more specifically, given the fact of this denser household situation, we need to understand, how do we deal with that? We're not living in suburbs where you've got one person per bedroom. You know, we're dealing with Latino barrios where you're going to have 2 or 3 persons per bedroom. And that has not been part of the thinking in terms of public health prevention, because we norm everything on what happens in Walnut Creek.
Thank you. Thank you for that, Dr. Bautista.
I would just add, I'm sorry.
If I may ask one question, and I want to go back to Senator Maria Elena Durazo's question about specific legislation. We're beginning a new legislative year, and there have been a number of proposals from just about everybody from the Latino Caucus on this call, whether we were the authors or we as a caucus supported them. Clearly, there's so much more that we need to do. And it's clear from the statistics and the anecdotal stories that we all have heard. But if not during this webinar, if soon thereafter, through the Latino Caucus or individually, you could provide some specific legislative suggestions. And if not legislative suggestions, what many of the members of the Latino Caucus have done is that we've requested audits through the state in certain industries, and those have proven very effective because now we get the full picture. But there's so much more, and we feel the weight on our Latino communities. And we as a Latino Caucus, we do try to do everything that we can. And I'm really proud to serve with the members that I serve with, because we have el corazón lo tenemos con la gente, con el pueblo. And if we have those who have studied this the way you all have, work with us on very specific legislation, please know we're at the beginning. You know, okay. December is that when we're starting to put our packages, our legislative packages together, and you go down the list of every legislator on this call, and you will see all of the champions. Okay. So share with us, honestly.
And if I could just suggest, by the way, this may be an issue of framing more than anything else, because the narrative that we have heard as Latinos are always so needy, they always need something. If we could reframe it as, no, we're investing in opportunity. This is the growth spot for the US GDP. It's the growth spot for the next 50 years. Hello, let's unleash it. Let's empower it. Let's get behind it, and let's make it be as productive as it possibly can be. That would be a different framing.
Well, trust us to frame it that way, because if you had been in our Latino Caucus meetings with former chair Lorena Gonzalez, our new chair Maria Elena Durazo, and our vice chair, you're hearing that from coming out of our mouths, because you're right, it's the framing that's going to make the difference. Most people don't care until it affects them. We care because it affects us, it affects our families, our neighborhoods. But for others that we have to convince, you're right. We have to frame it in such a way that it affects them. And we're prepared to do that. And we want to work with all of you who are the experts in your fields. Let's do it.
I'll send you a copy of our GDP report. If you haven't got it, I'll make sure you get one.
Wonderful, wonderful. Thank you. And thank you both for those presentations. I was driving, so I got to hear you. I didn't get to see you, but it's good to see you now at this point. Thank you.
I think Sharon, I'm
yeah.
sorry, Assembly Member Quirksova, just 1 second. Assembly Member Reyes, can you just tell everyone the district that you represent, where you're from? And as you speak, Assembly Member members, please let everyone know the part of California you represent.
Absolutely. I represent the Assembly District 47, which is right in the heart of San Bernardino County, from Fontana, Rialto, San Bernardino, Colton, Grand Terrace, and I have 2 unincorporated areas of Muscoy and Bloomington. Majority Latino, majority hardworking, as with everybody, all of my other colleagues. We know our people are the hardest workers, and I appreciated that comment. I think it was Dr. Hayes Bautista, when you commented that it isn't for lack of work. The work is there, it's a lack of pay. And that is probably the key in all of this.
Thank you.
Thank you.
Thank you. Assemblymember Quirk-Silva.
Yeah, I have a few comments and then a question. I represent North Orange County, and that includes Fullerton, Buena Park, Stanton, La Palma, West Anaheim, and of course we have some of the largest universities with Cal State Fullerton, over 40,000 students, Fullerton College. But as with others that have spoken, I very much agree that we not only have seen our Latino community hit hard, but devastated. One of my questions is, being the chair of the Entertainment and Arts Committee, which also includes all sports, which includes K-12, higher ed sports, professional sports, all professional venues, like for example, Staples. One of the things we're grappling with the state is, of course, we know that almost all of our areas have been moved back into the purple tier, most restrictive. We also know that EDD has pretty much run its course for many people that were working. And if we're looking at some type of federal stimulus support, the earliest we may see that would probably be the end of February. And we also see looming evictions, as we need to get back to the state and fix that. So my question to the panelists, anyone that would choose to answer, is this: how do we couple being safe, making sure people can report, making sure they have all the right things that they need as far as PPE, but getting things open? And I know, obviously, as we just went down to this restriction this week, that's kind of an awkward comment. And I get called in on it all the time, which is kind of like, well, you want Disneyland and not so open, so that means you don't care about your community, or you want kids back on campus. And I guess I'd preface it with, I completely care, but I also want to figure out how people can get money into their hands to pay for their very basic needs. And is there solutions? I've been down to downtown Disney 3 times, where they're taking temperatures, where they're doing protocols that not even Targets or Walmarts or the airlines, or, I mean, we have to wear a mask, but what can we do to urge safety, but get people back to work? And it doesn't have to just be theme parks. It can be other places.
Well, actually, in terms of labor force participation, after we had the shutdown in mid-March, things really crashed in April. And actually in May, there was one V-shaped recovery. While everyone else was going south, Latino labor force participation bounced right back up and has continued to grow up. Now, the question is, how long can they continue to do that? They are helping to drive the post-pandemic recovery, but usually in the occupations and industries that rarely provide them the PPE, the access to healthcare, et cetera. Here's your answer. It's already at work. Are we going to step behind them and make sure they continue going? Or are we going to just twiddle our thumbs and let them finally become infected, and then they'll have to fall out of the labor force, and then we all miss out on that? So again, it's a matter of let's make sure, let's invest in what is going on right now, and that is the Latino GDP.
Well, when you say that, you mean making sure that those who are at work, whether it's Amazon delivering packages, cooking in kitchen, because we know, of course, food delivery is way up. We know package delivery. We know some of course, in assisted living homes, there's a lot of infections. But you're saying make sure we're investing by getting them the PPE, but how do we work with the governor's office to say there have been some examples of people back to work? Because we keep saying, well, if we open the theme parks, well, we already have the infection rate. So unless I'm way off, and again, my colleagues jump in and say, you're way off, Sharon, let's just.
Absolutely.
Uh-oh. Uh-oh. Sharon.
Darn. I guess my response would be and I'd like to have my colleagues, if they don't mind jumping in also, is are we way off thinking that you can couple getting people back to work with the proper PPE? And I'm not just talking Orange County, I'm talking across the state. Los Angeles has all these entertainment. Or is it just follow the governor's advice and let the numbers go down, but in the meantime, people aren't getting paid?
Yeah.
Dr. Hayes Bautista.
I was just going to jump in. Well, the fact of the matter is a lot of people are at work and very vital. I talk about food and farm workers. If you remember the first couple of months when people were fighting in the grocery stores over paper towels and toilet paper, if it weren't for the farm workers exposing themselves to the coronavirus, we would have been fighting over the last sack of oranges, over the last pound of potatoes in the stores. That would have been very, very serious.
Some Latino Caucus colleagues and our guests, I will just for the sake of time here, we will wrap this particular panel up. Appreciate the robust discussion and the questions, and we'll move on to our next panels. But Dr. David Hayes Bautista from UCLA, professor of medicine and director of the Center of the Study of Latino Health and Culture, and Ana Padilla, the executive director of the UC Merced Community and Labor Center. Thank you both for your presentation. Obviously inspiring a lot of questions, and we appreciate that. All right, friends, we will move on to our second panel. Actually have a number of panelists that are at least scheduled to be part of this. The panel is headlined Leaders in the Community and Workplace Findings and Recommendations. And it will be my pleasure to introduce Mr. Castulo de la Rocha, the president and CEO of Altamed, Teresa Romero, the president of the United Farm Workers of America, Caitlin Vega, the legislative and political advisor for the United Food and Commercial Workers International Union, UFCW, the Western States Council, the Transport Workers Union, and Unite Here, Local 11. Angelica Salas, the executive director for Chirla, the Coalition for Human Immigrant Rights, and Evelyn Alfaro, the member of Mujeres Unidas y Activistas and California Domestic Workers Coalition. So those are our distinguished panelists. Let's begin with, if he is available, we welcome him, Mr. Castulo de la Rocha, the president and CEO of Altamed. So Mr. de la Rocha, if you're there, we'd love to have you here. Welcome, sir.
Thank you very much. Good morning, Chairwoman Durazo, Vice Chair Rivas, and distinguished members of the Latino Caucus. Thank you for the invitation to join you today. I'm not going to get into a lot of the facts because obviously this group is very well versed on the impact that COVID-19 has had in Latino communities. Those of us who understand institutional racism firsthand knew that this loss of life would be inevitable. Patterns and practices of discrimination do not change and have not changed dramatically over the course of the last several decades. We understand that the state is working to address infection rates at the county level, focusing on disadvantaged communities that have been hard hit by this pandemic. But this does not address the root cause issues of this pandemic. We must be included in decisions that are being discussed about us. This is why this conversation is so important. Member of the caucus, I know that you know this very well. Respectfully, I would like to remind you that community clinics are a vital resource and safety net for Latino communities. 7.2 million people are served by community clinics. 54%, or close to 4 million, are served by community clinics statewide. We have proven this to be, time after time as a vital resource to our community. At the outset of this pandemic, we were there doing everything we could do to provide testing and treatment and providing treatment services to anyone who needed it, regardless of ability to pay or legal status. And we stand ready to partner with you and our state officials so that Latinos are prioritized in current and future pandemic responses. We really are tired of being the last priority. Our contributions, as David pointed out, to our state's economy are gladly accepted, while our existence is simultaneously rejected. Let me provide you with a sample of a couple, two or three things that are important to us as community health centers and healthcare providers in this pandemic. The opportunities at hand. Telemedicine. As you know, in late March, telehealth became essential overnight to our ability to provide primary healthcare services. This is still the case today. Our goal, and our ask for support, we hope that this is your goal as well, to make sure the health centers can provide ongoing COVID-19 response while guarantee that our doors will stay open long into the future. For this, we need your help and your commitment to the current telehealth flexibility provisions that would give community health centers the authority to continue to receive permanent payment for telemedicine on an ongoing basis. Going to be concerned as well about digital divides and how we close that gap in our communities. The second recommendation, COVID vaccinations or vaccine. Black and brown communities that were first on the list who die cannot be the last on the list to receive the vaccine, period, under no circumstance. We cannot let this happen. Trusted community health centers and not Fortune 500 companies are the vehicles you need to reach the communities that have been the hardest hit. Please prioritize these communities. Our voice must be present at all state vaccine planning efforts, including the governor's vaccine task force. Third recommendation, protection of Medi-Cal programs, including preservation of benefits for undocumented. We've made a lot of progress over the course of several years. Let's not change that. This program is crucial to addressing the social determinants of health for Latinos, especially during this public health pandemic. We must maintain a strong healthcare delivery system by keeping the gains you have made under Medi-Cal while growing and accelerating its coverage. To do this, the hold on Medi-Cal eligibility redetermination must remain through the end of 2021. We're not out of this pandemic by a long shot. Forcing redeterminations frequently will cause people to lose eligibility. This will assure that those who rely on Medi-Cal will continue to receive the coverage and the care that they need without fear of disenrollment. The fourth issue, this is something that's not new to the Latino Caucus, addressing Latino physician shortages in California. California has a severe shortage of Spanish-speaking physicians, the most underrepresented group in California physician workforce. This crisis was here before the pandemic. COVID-19 only magnified the issues concerned with physician shortage. David Hayes Bautista predicted some time back that at the current rate, it would take 500 years to reach parity with the rate of Anglo physicians to population in California. 500 years. This is not right, especially for a state where Latinos are the plurality and make a huge economic contribution. Increasing investments in the PRIME program is a good first step to increase the number of Latino graduates at the University of California Medical Schools. By the way, Michael Drake was the person responsible, who now is the president of the university, was responsible for instituting the first PRIME program at the University of California Irvine Medical School. Per the California Future Health Workforce Commission recommendations, stabilizing the current PRIME program requires an annual investment of $9.3 million from the state. $9.3 million, not much. This will secure funding for 393 medical students across the university PRIME programs and position the program for future growth. AltaMed supports this and recommends the expansion of this proven program to fund an additional 100, maybe 200 UC PRIME program slots on a per year basis. We can do this over an extended period of time. California is also facing a shortage of primary care physicians, increasing medical residency for teaching community health centers and health centers affiliated physician resident programs committed to and located in communities will be of enormous help. You got to graduate. If you graduate them, then you got to train them. The last piece on physician shortage is international medical graduates can also play a key role in increasing access to linguistically competent care for Spanish-speaking Latinos. The process for IMGs to practice in our state must be more efficient and include a mechanism to prioritize physicians from Spanish-speaking countries. California can and must do better to make certain that our physician workforce can meet the needs of Latinos in California now and in the future. Members of the caucus, I share in your philosophy that healthcare is a fundamental human right for all. Altamed, along with community health centers across the state, stand ready to help you care for the most vulnerable Californians and rebuild the Latino community. As a side note, between the California Primary Care Clinic Association and Altamed, over the course of the last 2 years, but specifically in this year, we organized a Get Out the Vote campaign focusing on low propensity voters. We use the historical relationship that community health centers have with communities and local communities. In some cases, some of us have been doing this for 40, 50 years. We use that connection, that sense of loyalty to that institution to organize Get Out the Vote campaigns. I am pleased to report that in the period between 2019 and 2020 and the elections that just occurred, we registered 250,000 low propensity voters and are assured that they voted in the last election. All this verified by researchers both at UCLA as well as the University of Irvine. We are trusted community institutions that have the interests of our community at heart, and we're prepared to work with our representatives on issues critical to our community. Thank you very much.
Thank you very much, Mr. De La Rocha, the President and CEO of Altamed. Thank you very much. We'll move on to our next panelist, the President of the United Farm Workers of America, Teresa Romero. Ms. Romero, welcome. Privileged to have you here. Proceed with your presentation whenever you're ready.
Thank you very much, Brian. First, I want to thank Chair Marilena Durazo for inviting me here today. I also want to thank Assemblymember Lorena Gonzalez and again Senator Durazo, previous Latino Caucus Chair and Vice Chair, for all your work and help, in particular in supporting farm workers. We look forward to continue to work with the caucus to protect these workers. As it has been said, California farm workers have suffered at once a perfect storm of a deadly perils. Too many have been devastated by the coronavirus pandemic, as it has been said, while they have also endured extreme heat and choking smoke from raging wildfires. Agricultural workers are especially vulnerable to COVID-19 because they must often live, commute, and labor in cramped, overcrowded, and unsanitary conditions. They're deemed essential and must do their jobs. They can't afford to miss a day of work, unfortunately, because they would not be able to pay the rent or put food on their own tables. An alarming number of farm workers are getting sick, yet most receive no federal benefits that helped other workers survive because of their immigration status. Most people are unaware how enduring discrimination still plagues farm workers due to their historic exclusion from national and state protections other workers long enjoyed. We in California have remedied some of these injustices. We thank Assemblymember Lorena Gonzalez and all caucus members who helped us end 80 years of racism by passing overtime in 2016. Next year, after 8.5 hours of work, farm workers would enjoy full overtime pay. In 2022, farm workers will receive full overtime pay at 8 hours, finally being treated equally like any other worker. Here, California farm workers were still treated differently than other workers this year in protecting them from COVID through workers' comp. When the virus first emerged, the UFW approached all unionized employers to ensure protections for the thousands of workers covered by union contracts. One company fell short, and it has been mentioned, the giant Foster Farms in Livingston. Your Latino Caucus leadership expressed deep concern over an LA Times report that the company failed to comply with state law by reporting only 1 of 8 COVID-related deaths to Cal Osha. You also cited Foster Farms for relying on its 2 quote-unquote doctors, a staff veterinarian and a food safety consultant, who did not seem adequate to handle a pandemic that has now infected more than 400 workers and killed at least 9. We constantly communicate with 50,000+ farm workers, and most of them are not under union contract, by utilizing social media platforms. Surveys showed most of non-union employers were not taking legally required steps to protect workers from COVID-19. Too many non-union operations, basic safety measures have been ignored. One company where workers staged one-day walkouts, work leaders who spoke out were terminated. The UFW and other food industry unions helped convince Governor Newsom to require 2-week paid sick leave for all food workers, including farm workers. But there is an urgent, ongoing need for enforcement of these and other requirements. Food insecurity continues. Through a partnership with Chef Jose Andres' World Central Kitchen, we supplied 189,000 restaurant-prepared fresh meals from April through August across rural California. We have thus far distributed some 40,000 additional food boxes. We're distributing more than 900,000 face masks in farm communities. As the pandemic worsens, the Trump administration has acted to slash or freeze farm worker wage. We stood in Fresno federal court last October and won an order to stopping the USDA from effectively cutting wages for both foreign and domestic farm workers by more than 5% in California and up to 1/4 to 1/2 in some other states. Then the day before the election, Trump moved to freeze for 2 years the pay of H-2A guest workers, which will also wreak havoc with domestic workers' pay. Beyond COVID and heat, farm workers suffered from a third plague, smoke from wildfires. Farm workers are supposed to be protected like any other employees, but farm workers tells us that many are still at risk. Employers must provide N95 masks if air quality index exceeds 150. One survey in September showed 90% of responding field workers had not been supplied respiratory masks. So the UFW has been handing out hundreds of thousands of donated N95 or equivalent coverings. Whenever you hear horror stories about farm workers' abuse, the industry says California has the toughest laws in the nation protecting agricultural workers. And this is true. But farm workers' experiences over the decades have been that the laws on the books are not the laws in the fields. With so many lives at risk, we cannot afford to have the same experience with COVID. Let's make sure mandates from the state of California are actually enforced in the fields. Farm workers are considered essential farm workers. Farm workers are feeding the nation and the world, and they deserve to be protected. Thank you very much.
Thank you very much, Teresa Romero, the president of the United Farm Workers of America. Next up on our panel is Caitlin Vega, the legislative and political advisor for UFCW and also affiliated with other organizations. Caitlin, the next 5 minutes are yours, whenever you're ready.
Thank you. And thank you, Madam Chair and members. Caitlin Vega, representing UFCW Western States Council, Transport Workers of America, and Unite Here Local 11. Thank you for this invitation. It is truly an honor to be on this panel with such distinguished speakers who have done so much in the fight for workers' rights. I want to really commend the leadership and the members of the Latino Caucus for taking on this cause of worker safety at this moment, and really demanding that you get results. And I have seen the impact of that work both through the bills that you have authored, the budgetary demands that you have made and won, and truly advocating for workers. I was thinking as I was listening to this that some years we have to persuade legislators to listen to our stories of what's happening to workers and to work with us. And this year, many of you came to us and said, what can we be doing? You guys should be doing more. Let's do stuff together. And we very much appreciate that spirit. I want to start by just saying, long before this pandemic, Latino workers were the most likely to die on the job, faced the greatest safety risk, faced the highest rate of wage theft and of misclassification. So the way I see the COVID pandemic is that it came in atop deep structural inequality, and just raised the stakes, made all of these issues truly about life and death. We have underfunded state agencies with insufficient staff. Many of you know there is a preference in the Capitol to legislation that limits enforcement to state agencies. And yet our state agencies are not able to enforce to meet the demands of the workforce, particularly the Latino workforce, and the way that the jobs and the sectors where Latino workers are concentrated have been what some call fissured with the use of labor contractors, misclassification, many layers of subcontracting. In industries like food production, meat packing, you will notice in the few citations that have been issued, they almost all include temp agencies and subcontractors operating in those plants. It is well documented that temp workers have the highest rates of injuries and deaths on the job. And so we see those practices concentrated where we have a Latino workforce, and they further put workers in jeopardy. So I would say that what we have seen over these past 8 months or so is really the, I thought that the earlier presentation about the power of the Latino economic contribution is so important in light of the lack of power at the work site that so many Latino workers have. And that's really what this is about, because would we have turned a blind eye collectively as a state or a country if the deaths had not been so disproportionately low wage Latino, often immigrant workers? I feel that, you know, the lack of earlier intervention had a lot to do with the powerlessness of this workforce. And so I believe every solution is linked to empowering these workers, building power at the work site, allowing them to enforce their rights when state agencies don't, strengthening the rights of the ability of state agencies to come in sooner, faster, in person, with higher fines and greater penalties, and helping these workers have access to a union. We have seen through the UFCW's efforts to protect workers in meatpacking plants. And I believe you heard it from President Romero a moment ago, even where there is a union constantly advocating for workers to be protected, it is extremely difficult to get intervention to protect those workers. It's extremely difficult to get employers to take the problem seriously, and it's extremely difficult to protect workers from employer retaliation. But without a union, it is virtually impossible. We have seen almost no citations at non-union employers, very little change in the working conditions in non-union plants and fields. And so I would urge you all to think about ways to partner with unions and to support workers in having access to unions, because we can play a vital role in the enforcement process. And UFCW has really, as a union, moved into that role for their members in this past year, as they have seen such high rates of illness. You know, for for a group of workers that often have multi-generational families who are deeply committed to families. The idea of bringing home a deadly virus is the worst nightmare for a worker to have to contend with, to know that you every day have to make the choice to walk into a work site where you will be crowded, where you won't be able to protect yourself, where you won't have access to fresh air, to masks, in some cases to hand washing, and then you have to come home to your family. That is an impossible position to put workers in, and we must do better as we go into the second wave. That is not the only challenge Latino workers have faced. Unite Here Local 11 is a hotel workers union in Los Angeles representing more than 25,000 workers. They have experienced unemployment rates around 90%, as the hospitality industry has been among the hardest hit in the by the COVID recession and closures. That means for these workers, many of whom have had the opportunity to win a union, to win employer provided healthcare, to win a pension, to win a decent wage, they are now left with nothing. And rather than partner with those workers, what we have seen from the industry is a preference to replace them with younger, cheaper, non-union workforce, to use the pandemic as an excuse to replace workers. We moved a bill earlier this year, maybe 3216, that would have required the hotels to hire back that same workforce, a largely Latino workforce. Latinas are the most likely to be put out of work due to this pandemic and the least likely to be rehired. So this bill would have addressed that, and that bill was sadly vetoed. So we continue to think that recall and retention policies are very important to protecting workers' access to good jobs, to union jobs, to jobs where they can speak out about health and safety violations. So lastly, just to move into a couple of more specific policy recommendations. Based on what we were seeing at UFCW with workers in food processing and meat packing in grocery stores, we saw workers who were not notified about their coworkers having COVID. We heard from our sisters and brothers in the garment industry about showing up at work and just seeing empty stalls and not knowing where people had gone, not being told about COVID rates. We passed a bill to require notification and reporting, but we were asked to make amendments to that bill that removed the presumption of retaliation when a worker reports health and safety violations. It is essential that we strengthen retaliation protections. There is no way educating workers about their rights doesn't work if they aren't allowed to actually exercise them without fear of retaliation. So we hope that that is something that can be remedied. We were also asked to remove higher penalties. We think penalties have to reflect the seriousness of jeopardizing the lives of workers. And so stronger unions, support for unions, stronger enforcement. Together, we must do better for Latino workers in California. Thank you so much for this opportunity.
Thank you very much. Thank you very much, Caitlin Vega. And our next presentation comes from Angelica Salas, the Executive Director of Chirla, the Coalition for Human and Immigrant Rights. Ms. Salas, welcome. The next 5 minutes are yours. Look forward to your presentation.
Thank you so very much. And I want to first begin by saying how much I appreciate the invitation to be part of this panel and the leadership of the Latino Legislative Caucus members in advancing the rights of immigrants and their families. Chirla is a statewide mass membership organization working at the local, state, and national level to create a just society fully inclusive of immigrants. First, in my remarks, I would like to highlight the importance of immigrants during this pandemic and even before to our economy. I will also outline the impact of COVID and the impact that COVID has had on our communities. And lastly, I will provide recommendations to the legislature to prioritize in the next session that will begin December 7th, 2020. First, California Governor Gavin Newsom ordered all non-essential business in the state to close in response to COVID-19. Per the definition provided by Governor Newsom, an estimated 4.6 million immigrants were deemed essential. That's 33% of all of the state's essential workers. These workers, as you've heard, are producing food and maintaining operations at hospitals and research facilities and distributing supplies across the state. California is the country's top agricultural state. Immigrants make up almost 2/3 of the agricultural workforce. And they are also there's about 980,000 of these immigrant workers who are responsible for the food supply chain. They are also 16.4% of all the workers in the US healthcare industry. And that is equivalent to 2.8 million immigrants here in California. In California, we have about 556 healthcare workers who are immigrants. Prior to the pandemic, immigrants were essential to our economy, to our workforce, and contributed to our state coffers. Immigrants today pay $38 billion in local and state taxes, and their spending power is $275 billion. So, however, all this contribution that they're giving to the state, but are they actually being protected, and are they actually are their lives being advanced the way that they should? Well, COVID-19 demonstrates that they are, even though populous and they're many, they're still invisible. COVID-19 does not discriminate. However, immigrants and communities of color are more likely to suffer from underlying health conditions and work in industries that don't permit them to work from home, as you've heard earlier. As a result, communities of color and immigrants have suffered more and are losing jobs, and they are losing their lives to COVID-19. As a response to the economic distress that immigrants were facing, we appreciated the first and unfortunately the only step that Governor Newsom took to provide economic relief for this population. The $75 million that the state committed, while critical and important, only assisted 155,000 individuals. That is less than 10% of the entire undocumented immigrant population of California. Chirla, in collaboration with other disaster relief assistance program partners, will be publishing a report with 91,000 responses of individuals who were assisted by this program. The highlights of this upcoming report are as follows. Nearly half of all the recipients indicate that they were affected by the closures of schools during COVID-19. Of these, 96% also indicated that their hours were reduced at work. More than half of the assistance recipients were women. They were about 53%. And for immigrant women ages 36 to 50 with school-age children, these are the worst of times. These are dire times for them and their families. One of the things that we saw was in terms of the needs, what were the unmet needs of these families? Well, covering housing expenses is the most pressing need in the face of this crisis for these recipients. This was the most common unmet need, and where they said they were immediately going to use these $500. Many had gone into debt to pay for housing. And we heard cases of individuals using this money to pay back loans that they have taken on in order to stay in their homes. And this is to, these unscrupulous loan providers that also abound in immigrant communities. So more than half of the total recipients report unmet needs in terms of food, 57%. And of those that have children at home, 53% that they will use the assistance solely for food. And I wanted to provide right now just a really brief, share my screen and share just a really brief overview of this particular situation for families. And I might be having problems with this, so we're gonna try this again.
We know this is part of our new normal in this world of Zoom is figuring
Yes,
out
and here it
sharing
goes.
screen. There you go.
And here it goes. We did it. So as you can see, of the 91,042 individuals in this universe, you can see that the needs that they're describing, 87% for food, 87% for housing, 54% for food, 53% for utilities, 13% for transport, 9% for childcare. And only 27% of these individuals qualified for any kind of CalFresh or any other program. So it's important for us to see these needs, because for us, it really they're telling us the story. They're telling us what their needs are. So now I think it's important to then go to the recommendations. So our recommendations: we urge the legislature to ensure that state relief is equitable and available to all Californians, regardless of immigration status. The federal government has a responsibility and jurisdiction for administering immigration status. However, California has to be the strongest voice for immigration reform and justice in a Biden and Harris administration. The states, however, also have responsibility. So states and local governments are able to create and expand and invest in programs to integrate and create opportunities and protect immigrants. California has understood the importance of protecting immigrants, even during periods of great anti-immigrant sentiment. In 1996, in light of the enactment of the Personal Responsibility and Work Opportunity Reconciliation Act, better known as welfare reform, there was really draconian provisions that ejected disabled and elderly legal permanent residents from federal funded programs. California created state funded programs to assist those immigrants. California has continued to make progress to integrate immigrants. However, it has also implemented a fragmented approach. That is why the legislature must enact a comprehensive approach to create equitable relief with a path to prosperity for immigrants. A comprehensive approach can be accomplished by creating the California Residency Program. The concept will be to align public policies with community goals during and after COVID-19. At minimum, all residents would receive emergency and basic services necessary to protect their personal and physical safety. The vision of the California Residency Program must strive to create state-specific programs and/or eliminate current immigration restrictions in these programs. The following are programs that the state could expand. This is the California Food Assistance Program for immigrants, the Cash Assistance Program for immigrants, state Medi-Cal. Undocumented workers have access right now to workers' compensation. The legislature must create a wage replacement program to assist immigrants displaced from their jobs due to COVID-19. The state can also create an agency of immigrant affairs. There are currently 4 states that have already created these programs. That's Massachusetts, Illinois, New York, and Michigan. In 2015, Governor Jerry Brown created the position of the statewide director of immigrant integration, which has been critical to assess the challenges that immigrants and refugees face in our state. And we also have had the Department of Social Services oversee the One California program. Despite this progress, California continues to lack a comprehensive and multi-agency approach to integrate immigrants. So we need to create a government agency, a secretary, to promote and facilitate and work towards full integration of immigrants and refugees. Immigrants, irrespective of status, are vital to California. And only when the state truly invests in their well-being will the state then be able to say that it is a California for all. So I want to really thank you for inviting me today and to speak on behalf of California's immigrant communities who desperately need support in order for their families to advance and to survive. Thank you so much.
Thank you very much. Angelica Salas, the Executive Director for Chirla, the Coalition for Human Immigrant Rights. Well, our final panelist for this second panel, and again, lawmakers, caucus members, you will have an opportunity afterwards for any specific questions. Before we move on to the next, is Avallero. She's a member of Mujeres Unidas y Activas and the California Domestic Workers Coalition. Ms. Alfaro, welcome. The next 5 minutes are yours. We look forward to your presentation here.
Gracias. Buenos días, la verdad estoy muy agradecida por invitarme a este espacio para poder ser vista y escuchada máximo en este Caucus Latino de la Legislatura de California, especialmente con este tema tan importante que es para mí como para mi comunidad latina, que todo lo que nos está afectando, lo que es esta COVID-19. Quisiera también agradecer a todos los líderes de este espacio, especialmente a la senadora María Elena Durazo por haber hecho SB 1257 una prioridad para todos ustedes. Quisiera compartir que en California el 51% de trabajadoras del hogar somos latinas. El 87% de trabajadoras de limpieza de casa somos latinas. Y el 49% de las trabajadoras como niñeras somos latinas. Esto realmente no solo son estadísticas o números. Estos son más de 150,000 personas reales como yo, que te trabajo limpiando casas por más de 11 años aquí en California. Y soy miembro líder de Mujeres Unidas y de la Coalición de Trabajadoras del Hogar. Como limpiadora de casas y niñera, estoy en primera línea del COVID-19. Ya casi a 8 meses de que empezó esta pandemia y esta crisis pública, aún carezco de protecciones laborales que podrían disminuir los impactos que el COVID-19 tiene en mi vida y en mi comunidad. Cuando empezó la pandemia, me quedé sin trabajo de 17 empleadores que tenía. Solo un empleador siguió dándome trabajo. ¿A cambio de qué? El empleador me pedía desinfectar todas las áreas con productos tóxicos como el cloro. Sin embargo, no me proveía ningún equipo de protección ni para protegerme del COVID, ni mucho menos para evitar intoxicarme. Lo que significaba que respirar en mi lugar de trabajo era arriesgarme a morir. Tenía miedo de enfermarme, ya que mi industria de trabajadoras del hogar no cuenta con derechos laborales que garanticen mi salud y mi seguridad en mi lugar de trabajo. Otro riesgo que también tenía era que a la hora que yo me infectaba, iba a infectar a mi familia, ya que en mi vivienda comparto el cuarto con mi hermana y mi sobrino. Mi situación económica empeoró drásticamente con esta pandemia. Con un empleador que tenía, no me daba como para poder sobrevivir, no tenía para cubrir mis gastos, y esto realmente fue algo muy difícil para poder sobrellevar. Pude sostenerme durante estos primeros meses utilizando mis ahorros que había hecho para poder realizarme una cirugía que necesito en ojo, en la cual no me la he realizado. No me he recuperado al 100% del impacto económico de esta pandemia porque no tengo acceso a beneficios de red de seguridad. Ahora estoy volviendo a mi trabajo, que ya sé las medidas que tengo que tomar para por lo menos minimizar el riesgo de contagiarme. Pero sin embargo, no cuento con ninguna institución gubernamental que garantice mi salud y mi seguridad como Osha, o las restricciones de salud y seguridad estrictas que se han requerido en otras industrias de trabajo. También estoy haciendo voluntariado en un banco de comida que es aquí en La Misión, en San Francisco. Ahí me proveen un kit de primeros auxilios o de que pueda yo utilizar para protegerme, y es lo que he estado utilizando ahorita que estoy regresando a trabajar. Sin embargo, esto no es suficiente porque tengo que comprar más equipo para protegerme. En mi comunidad latina, tanto como trabajadora del hogar y de otras industrias, fue afectada realmente demasiado. Sé que se creó fondos para poder apoyarnos un poco, pero realmente no fue realmente accesible para todos. A nosotros, las trabajadoras del hogar, los empleadores nos dejaron de llamar, y a las que llamaban nos ponían en riesgo de contagiarnos. La comunidad latina fue devastada con la pandemia. Hemos sido una comunidad realmente olvidada, bajo la apariencia que sí ha sido escuchada, pero realmente no ha sido así. Nuevamente quiero agradecer grandemente que me han dado la oportunidad de expresar esta voz representando mi comunidad a las trabajadoras del hogar, y que seamos realmente vistas y escuchadas, que nos pongan en prioridad, porque ya estamos como de cierta manera cansadas de la desigualdad que existe en nuestra industria. Nosotras como comunidad, como trabajadores del hogar, sabemos salir adelante, luchamos por nuestros derechos y queremos sobrevivir a esta pandemia. Y para esto necesitamos el apoyo del gobierno que ponga su vista y atención en nosotras, especialmente en medio de esta crisis pública. No podemos esperar más a ser incluidas en las protecciones laborales. Realmente la exclusión continuará matando a más trabajadoras del hogar, quienes somos principalmente mujeres latinas inmigrantes y seguimos expuestas al COVID-19. Realmente queremos de su apoyo y que podamos nosotras salir adelante. Muchas gracias.
Thank you very much, Evelyn Alfaro, member of Mujeres Unidas y Activas. Panelists, thank you so much for your presentation. I will open this up to Chair Durazo and her colleagues in the Latino Caucus, and just will limit our conversation and question time to only about 10 minutes. So I urge all of the Latino Caucus members respectfully to be as to the point as you can in your questions or comments. And also keep in mind, we will have an opportunity before we wrap this briefing here shortly to be able to have you share some closing thoughts as well. So Senator Durazo, to you and your colleagues, any questions you have? Again, folks, feel free to just take yourselves off mute and chime in as appropriate, and we'll take as many as we can. Be as brief as you can. Thank you.
Okay, members, anybody want to jump in? I see Assembly Member Cecilia Aguiar Curry joined us as well. Thank you for being on. And I think, I don't know if you were on earlier, Senator Lina Gonzalez, thank you also for coming on. Who else? There you are. Okay. Anybody have any comments or questions about our panelists?
Senator Durazo, this is Ana Caballero. If I could real quick, I've got to jump off, but I just want to thank this panel for their suggestions, their personal stories, and for the work that they do. This has been incredible, and I think very, very helpful to understand the issues in the different industries and how we can be supportive. And so I just want to make sure that everybody hears how impactful I think their testimony is, and that I really appreciate it. Y para la señora Evelina Alfaro, muchísimas gracias por su testimonio. Es muy importante poder darnos la información, porque solamente escuchando lo que acaba de decir podemos hacer los cambios necesarios. So, muchísimas gracias, cuenta con nosotros, cuenta conmigo, y gracias por su participación hoy. So thank you so much to everybody. I really appreciate it.
Thank you, Senator Caballero. If you can just, I don't think you had a chance to say, describe your district, who you represent.
Yes, my district is district number 12. It's the Salinas Valley, and then a number of counties in the Central Valley. And it's a large agricultural district, and it's a blue collar district. And I'm very proud and pleased to represent a lot of farm workers and a lot of workers that UFCW workers, United Here workers. So thank you very much for your testimony. It's been terrific to hear from you today. And I'm know that we're really struggling trying to figure out how we work with the governor to make sure that we're getting the resources we need for our communities. But we're there with you. We want to be there.
Thank you, Senator Caballero, for being on and listening to all of these panelists.
Thank you very much. It's been an honor.
Okay. Anyone else of our caucus members? Yes, Senator Reyes.
Assembly member.
Assembly member.
No me cambies el título, por favor. Dr. Castillo, I just want to thank you so much for your conversation regarding the shortage of doctors, physicians. It's extremely important. Here at UCR, when they opened up the medical school, I will tell you, and you know this already, that was part of the requirement, is that they had to take people from the community And once they began school, and they had to do their residency and stay within the community. That is extremely important. I think that's a model that should be used in many of the other, even those well-established medical schools. And I appreciate the comments regarding the clinics. I think that's something that there should be policy about that. And I would certainly love to discuss this further with you. I'm sure my colleagues would also, on how specifically we include that language, because the state of California often provides funding to many of these medical schools, and we can have strings attached so that our community receives more benefit from this. Very specifically, are not just those who speak Spanish, but there also has to be the bicultural aspect of this. And that was something that was emphasized here at UCR. So thank you so much. And to our other speakers, Teresa Romero, Caitlin Vega, champions when it comes to protecting our workers. I sincerely appreciate your leadership in all of this, that having you continue, especially las mujeres. What can I tell you? I love it that we've got the leadership with our women, making sure that we passed the right legislation. Caitlin was so helpful and great leader in making sure AB 685 was passed. So I sincerely appreciate her. Evelyn, gracias una vez más por todo lo que usted nos platicó, porque sí necesitamos oír su voz de las personas, no solamente de las que hablamos de lo que le pasa a otras personas, pero de las que lo están sintiendo, lo están viviendo. Muchísimas gracias por eso. Thank you so much.
Thank you, Assemblymember, and I do want to remind folks we still have one more panel, so make sure you stay with us. But if there's anybody else from the caucus, again, with the second panel that has some questions or comments, got a couple of more minutes if you want to throw something in.
Senator Gonzalez had her hand.
Thank you. Hi, everybody, and thank you so much. I cannot say how amazing this panel is, and I know many of you are in my backyard, and we've talked about the Latino experience. But now this is the Latino experience with COVID. And so you all have been on the front lines. I just want to say thank you very, very much for this amazing panel. I've actually been taking notes vigorously. I've been tweeting about it. People are giving us a lot of good feedback. And the solutions you provided are really, really great. I'm just wondering from this panel, similar to what Dr. Bautista said about messaging it differently for Latinos about our GDP and the economics, are there any other messages you think that we can discuss that can change the direction we're headed in? I mean, I know a lot of businesses are still not, as you've discussed, still not prioritizing our community, but yet we've been the ones that have been fueling the community even during this crisis. But is there any other messages that we can take away from this that can change to more positive messaging for our community during this crisis?
I answer this one. So for me, it's really important that we continue to talk about we're taxpayers. We are taxpayers to the state, and the resources that we want to be reinvested in us are basically the resources that we paid. And so this idea, for example, and I want to really thank Assemblymember Miguel Santiago, who carried 1826 for us, which was a food voucher program. The veto message from the governor was it would be too expensive to the general fund. Well, that general fund, those resources, those are our resources. And in a moment when we have a pandemic, not to allow people to have a food voucher who are undocumented is unconscionable. So I think it's really important that we start first with we are making decisions about the tax dollars we pay into the coffers, including the undocumented. And that's why we provided you with additional information about the billions of dollars that our immigrant families pay to the state and that are needed now for their survival.
And can I comment really quickly? Senator, I agree with you, and as well as with David Hayes Bautista and the positions and Angelica. I have to say, we're still in the midst of this pandemic. We're not out of this. There's a lot of things that still can be done by appropriately prioritizing the governor's agenda on many of the issues impacting our communities. There's an opportunity between now, the end of the year, and now the end of 2021. Why should we be last in vaccinations? We were last in treatment and doing the testing, last in treatment, testing and treatment. We shouldn't be last in terms of vaccinations. We should be prioritized. Look at who's on the advisory committees to the governor and to the state legislation, to the state at this point. We need to change that now so that as soon as that vaccination is available, those that have been more dramatically impacted by deaths, by people who've been hospitalized, will be the first prioritized. We're not prioritized at this particular point. So that, well, on the one hand, we need to stay positive. We need to stay affirmative, focused on the immediate needs that we have in our community. And that needs to change from a prioritization standpoint at the state level.
Thank you, Angelica, and thank you, Castulua. That's a very, very good point. And I represent, just many of you know, but I'm Long Beach from the coast through Southeast Los Angeles, Sela, and then the South LA portion of unincorporated LA.
And if I may add, I think what both Angelica and Castro have said makes a lot of sense. But I think one of the problems that at least we in the UFW see is that although there might be programs that are there to help our Latino community, it is very difficult to really get those programs to rural communities. And I just want to make sure that we take that into account, because farm workers live in small communities where the communication and the information is not flowing through. And we need to figure out how we're going to make sure that rural communities, farm workers and Latinos are taken into account.
Thank you all, Assembly members and senators, for your questions and comments for our second panel. Thank you, panelists, for a really robust discussion. Just for the sake of time, we will move into our third and final panel. And again, everybody, the Latino Caucus members will also have a chance before the end to wrap up with any final comments. Our third panel is headlined "The Administration's Pandemic Response for Latinos, Lessons Learned and Next Steps." Our panelists are Dr. Erica Pan, the Acting State Public Health Officer with the California Department of Public Health, and Doug Parker, the Chief of Cal OSHA. Let's begin with Dr. Pan with the California Department of Public Health. Dr. Pan. Doctor, the next 5 minutes here on Zoom are yours. We look forward to your presentation.
Great, thank you all very much. I will admit I've been kind of on and off and listening to some of you, but I just want to start with saying how inspired I am by a lot of the great work and the other panelists. Just really great work happening in California. And just on a personal level, I actually vivía en Tucson, Arizona. I was surrounded by, sort of a Latin American community growing up. So I'm Chinese American, but I actually very much identify with the Latin American community. And pasaba un verano en la Ciudad de Mexico. And my Spanish is much better. My kids are learning Chinese, which I don't speak, but I do try to speak a little Spanish when I'm taking care of patients. So I also just wanted to share a couple just high-level thoughts before I go into some of the more prepared comments. And in response, I think I really appreciated this reframing of investment in the GDP and the Latin American community. And in general, I feel like from a public health perspective, I feel like a lot of our messaging, a lot of our motivation for people at all levels is we need a new framing, I think, for many things. So I just really wanted to highlight, I really appreciate that and want to think more about that. And I think we've been talking a lot in the public health side about how we really need more economic analysis to help kind of make that prevention case and that investment case in public health. I think there's a lot of short-term investments in our society, and it's really much harder to make those public health cases. So I just wanted to, shout out to that. And then I know I just wanted to highlight too, in a lot of my more prepared remarks, we didn't actually touch on vaccine, but I did want to let you all know that we very intentionally made sure that there were at least 2 representatives on each of our key committees related to the drafting allocation guidelines work group for the vaccine committee. So Dr. Sergio Aguilar Gaxiola, who's at UC Davis Health, many of you may know him. He was the founding director of the Center for Reducing Health Disparities. So he's on that drafting guidelines work group. And then also Dr. Catherine Flores from the UCSF Fresno Latino Center for Medical Education and Research. So the 2 of them are on that allocation work group to represent the Latino community. And then also in our scientific advisory committee, we also have Dr. Tomas Aragon. He's from San Francisco. He's a health officer, but also an infectious disease doctor. very versed as well and a high priority for health inequities, and Dr. Bonnie Maldonado from Stanford. So we did, as an administration and as a public health department, want to make sure that we were including people who really have a focus and an eye on that when we're thinking about those this allocation. And then we're just now putting together our community advisory committee, which it also definitely is going to include communities of color and people who are really focusing on these issues. So wanted to make sure you all knew that and knew who your points of contact could be if you wanted to also reach out to advocate specifically. So to back up and just quickly, over the summer, we of course definitely noticed that there was an increase of COVID-19 cases, hospitalizations, and deaths, and disproportionately in the Latino community. And then a preliminary analysis of that, looking with our occupational health branch, suggested that amongst the deaths that we were seeing in the Latino population, that there were multiple major occupational categories with essential critical infrastructure jobs. And some of that was highlighted by some of the earlier panelists. And while Latinos make up about 20% of deaths in management, business, science, and arts occupations, which include healthcare practitioners, they make up the majority of deaths in the other major occupational categories. So natural resources, construction, maintenance, production, transportation, and material moving. Sales and offices, which includes jobs like retail sales workers and cashiers and other service occupations. So healthcare support jobs and home health aides, food preparation jobs, janitors, and other cleaners. So a work group was developed in late July, composed of departments across our Health and Human Services Agency, as well as across the state agencies, to address the disproportionate impacts of COVID-19 in the Latino community. And a response strategy was developed to address the disparities within the COVID-19 pandemic, and there were 7 key areas that this group wanted to address. So data-driven approach, testing and lab capabilities, contact tracing and case investigation, isolation and quarantine, public messaging, healthcare access and public health interventions targeting these comorbidities, and partnering with other state agencies. And then we tried to divide those into short, medium, and long-term strategies. Kind of the short term really being immediate, looking in within the first 3 months, and then midterm kind of 3 months to 6 months, and then long term 6 months to 18 months. Although obviously really long term would be longer than that. So a few highlights of some things that came out of those efforts. We worked with local public information officers at the county and local health department level to have a packet of educational and outreach materials to look especially at the unique needs of agricultural farm workers within the Central Valley, including translation into multiple languages, including Spanish, Hmong, and Punjabi. And then our policy and guidance team has been leading some fact sheets, which try to provide some simpler at a glance type information. We're doing other things that are in development to, again, have more user-friendly things and then get them translated. So materials related to our blueprint and our employer playbook, a lot of the school and cohort guidance for young children and testing information and case and contact management. So all of those things are in the works. We've really focused on making sure we could bring rapid testing resources into the Central Valley, working again on deploying more and more mobile testing. It's certainly been a priority as we have stood up our regional lab and new testing resources to make sure we're prioritizing areas such as Madera and Fresno and Central Valley. And then the other media campaign was, again, to raise awareness of the disproportionate impact on Latino workers. And we had a lot of sort of social platforms in August. We sent things to the local health departments in September for sharing at the local level. This included a multi-generational housing media campaign that offered guidance on how to live safely in a multi-generational household and how to care for someone that has COVID-19. That ran in July, and then also again in September. And then there was a farm and processing plant training video with Q&A, and Dr. Chavez, who is my predecessor as the state epidemiologist as well, who's still co-chairing our testing task force, was sort of the face for that, and that launched in September. We partnered with the Agricultural Council of California to produce that video for farms and processing plants. And the campaign components included a 12-minute training video and a social media post campaigns focused on COVID and worker safety. And then we did put out some immunization campaigns as well. So one was focused on children and families getting up to date on their vaccines. That was launched in September as well, and a flu campaign that was launched in October. And that was, who are you getting your flu shot for? Sort of emphasizing that you're getting it for your loved ones as well. And we had different figures sort of doing those PSAs. So again, it was Dr. Chavez, Dr. Nadine Burke-Harris, our Surgeon General, and myself had different PSAs that we put out related to that. There was a great Fresno County COVID campaign that we also shared with other partners to help disseminate that because they had some great materials. There was a Labor Day social campaign, again, trying to have more talking points on these various things. There were some Dia de los Muertos safety messages that got put out in October. Let's see what else. And then we're working with the Mexican consulate as well on a series of Facebook Live events. And the goal has been a total of 3 or 4 events, and there have been a couple of those in October already. And other partners for that event included the Health Education Council and the California Rural Legal Assistance Foundation. So those are also, have had a couple and a couple more in the works. I think the other key thing we've been doing is working really closely with our local health department partners to really understand the key factors impacting the Latino community in their jurisdictions. So again, trying to think about how to increase public awareness and education that's culturally appropriate, getting PPE, a lot of the worker rights issues that a lot of you have mentioned. And I know my colleague Doug is going to talk a lot more about that from Osha after I stop. And a lot of great work has been happening on the local level as well about income replacement strategies. I've seen a lot of great local passage of wage replacement and things like that, paying people to isolate, providing more housing and testing. There were 3 different unified support teams that went to the Central Valley in August to provide hands-on technical assistance on the ground, and they met with community-based organizations as well in 8 Central Valley counties to understand the specific issues, and that really focused on Latino families and communities. And what else do I want to highlight? I think we talked about the Mexican consulate partnership. We also had, hopefully some of you saw our other campaign that it was a dual campaign looking really wanting to get outreach to Latino and African American populations. And so it was El COVID and La Rona campaigns, and that's been airing since September in various statewide media markets, and that will continue through December. And if you want links to some of those messages, our office can definitely get you those. And we really tried to focus that again on areas that have higher COVID-19 cases in Latinos and African Americans. So Southern California, I did note that many of you are representing Southern California, where we are definitely seeing, huge rises again statewide, but certainly Southern California has, for many of the jurisdictions, as many of you know, has not gotten out of the purple and has really skyrocketed recently. So focusing there, as well as the Central Valley, Central Coast, as well as the Bay Area and Sacramento. And then I definitely wanted to at least touch on the health equity metric. Hopefully, again, you all sort of took notice of that. And there was a lot of great work and a lot of good stakeholder input into that. I think I will just acknowledge there is nothing perfect about how to measure or quantify or address, but I think we were the first state in the nation, and I believe still the only state, to really tie health equity and work on equity to reopening and allowing counties to move forward. So really proud of this work that is really difficult. And again, that I think, what we've sort of tied it to is the Healthy People, Healthy Places Index, which many of you may or may not have heard of, but this index is something that the Public Health Alliance of Southern California has put together, and it takes into account various different components of socioeconomic opportunity in these census tracts, including social, education, transportation, housing, and environmental factors and neighborhood sectors, to try to come up with an index. And then each county, we've looked at their census tracts based on this Healthy Places, index, and the lowest quartile of that is where, just to have some sort of comparable standard across all the different counties, was where we said you have to look at that, the lowest quartile in your county, and your test positivity in that area cannot be higher than your whole county as far as being able to move forward. So in other words, you can't move your county forward until you make sure that your most disadvantaged are actually at that same level. So that was implemented we intended from the very beginning with the blueprint to have a health equity metric, and then it took us a few weeks to really make sure we really thought through the different options of that. You know, we talked a lot about should we have it based on deaths or hospitalizations versus test positivity, and we wanted to be as upstream as possible to really prevent things rather than waiting for what we would call a lagging indicator, and also just getting as much stakeholder input as we could into that. So I think, you know, there's a lot of great input. It evolved a lot. So we have made that a requirement in order for counties to move forward, and then actually also an incentive. So there's sort of an accelerated health equity metric that if a county is in purple, for example, but their overall test positivity and their lowest quartile or health equity quartile test positivity is 2 tiers below. So if it's in the orange tier, they could actually be qualified to move into the red tier, even if their case rate, for example, was higher. So that actually got a few counties to be able to move forward based on really focusing on the population in their health equity quartile. Again, unfortunately, now we're in a place where the whole state, I think we're really kind of, you know, couldn't escape from the whole nation really increasing, and also the pandemic fatigue we're seeing. But those are things that as we, you know, get through this next surge and hopefully flatten this curve and get around to the other side of this, will still be an incentive and a way that we can really get a lot of these equity issues.
Hey, Dr. Pan, not to interrupt you, but I want to make sure we give Mr. Parker some time. If you had just any final thoughts here in your presentation, would love to hear them, and then we'll move to Doug Parker.
Sure, thank you. And I think the last two things are that with that health equity metric, we developed health equity technical assistance teams and a playbook. And it has a lot of examples from both within California and outside of California of things that local jurisdictions have done to, again, move the dial. And again, things like housing, wage replacement, a lot of these things and a lot of you have brought forward. So that health equity playbook is another resource that we're continually updating and providing technical assistance to the counties to help them address these disparities. So with that, I will stop and let
No,
Doug
this
go
is
ahead.
wonderful. Thank you so much, Dr. Erica Pan, who is the Acting State Public Health Officer with the California Department of Public Health. And here on our last panelist, but we will say last but not least, Doug Parker, the Chief of Cal OSHA. Mr. Parker, welcome. You've got 5 minutes here. Looking forward to hearing your presentation.
Thanks very much. I appreciate the invitation from the caucus to speak to you all today and answer your questions. Excuse me. I haven't used my voice lately. I've been listening. So I first want to just acknowledge the important work of essential workers and acknowledge the fact that so many of them are from the Latino community. They have made incredible sacrifices to keep our economy and our society going. And I think that it's critically important that we hold those folks up with honor and respect and not carry forward our recovery and survival of this pandemic on their backs. So I really appreciate the importance of this meeting and the opportunity to talk more about this issue. At Cal OSHA, we've been trying very hard to focus on protecting these essential workers and making sure that our resources are directed where the most critical needs are, and those are with essential workers. We've worked to maintain the high standards that California has been known for and being at the forefront of worker health and safety throughout the pandemic. I thought it would be useful to provide the caucus with a sort of brief overview of our strategy. We, of course, have been in a situation where we have tried to use the resources that we have in order to address a massive problem and to do so strategically. The first thing that we identified of three main strategies was to leverage our knowledge and our expertise to make sure that we were putting clear protections out there for workers. So the first thing that we did when the pandemic was beginning was to start working on guidance. And the first guidance that we worked on, recognizing the impact that this was going to have on essential workers, was in areas like agriculture, in areas like construction, in areas like groceries and warehousing and logistics, understanding that those areas were going to be impacted. And we also made sure that we were at the same time putting out information that was going to be in Spanish. We also were sensitive to the fact that not everyone was going to have access or find useful those written materials. So we also put out video information on how to protect oneself, not only in English, but in Spanish and Mixteco early on in the pandemic. And we've continued to put out guidance in collaboration with CDPH and across other agencies in collaboration with Food and Ag and others. And we've put out guidance on almost 40 different industries, checklists on almost 40 different industries, and lots of information that we've made clear to employers we can use and expect them to use as a roadmap for enforcement under our current requirements for employers to have an injury and illness protection plan. And that's been the basis of most of the citations that we've been writing outside of the healthcare industry. The thing that we're currently doing, and I think is critically important, is that we have developed an emergency temporary standard. We've proposed that to our Occupational Safety and Health Standards Board. And in fact, that's going to be voted on tomorrow before the Occupational Safety and Health Standards Board. So if it's approved, it will be a critically important tool for us to help protect essential workers. And I hope if you haven't reviewed it already, when you do, you'll see that it reflects the fact that we've been listening to the concerns of those who represent essential workers and the concerns of those who represent the interests of Latino workers, and that it reflects the lessons that we've learned so far in this pandemic. Some of the provisions that it includes are mandatory testing provided by the employer if there's an outbreak to address the kind of situation that we had at Foster Farms. So we don't have to wait for the intervention of the local health department or for Cal Osha. It's a requirement to immediately occur. It provides in some circumstances for removal from the job with pay. So we don't have to worry so much about workers being afraid to report symptoms, being afraid to report positive cases or seek testing because they're worried about their job. It has clear physical distancing and face mask requirements, face covering requirements. It contains the reporting and notice requirements that are in AB 685. We went ahead and put those in the emergency standard so we can go ahead and start enforcing them now. And they're in a format where our inspectors can issue citations on them. It includes the right of workers to participate in addressing COVID hazards and evaluating the workplace for COVID hazards, as well as a number of other important provisions. So we tried very hard to reflect the concerns of essential workers in drafting the standard. In terms of outreach, our second strategy is just making sure that employers and workers are aware of of what the requirements are and what best practices are. I've touched on some of that already, but I also want to point out that we have that we currently have developed a training academy so workers can go directly to our website and receive video training on best practices and rules for COVID-19 prevention of transmission. The video in Spanish is in production. We only have an English version right now, but the Spanish version is in production and should be online shortly. I also want to highlight that we're thinking about the needs of essential workers when we think about the implementation of AB 2034 and SB 115. SB 115 allocates $32 million to the labor agency to do worker outreach on COVID-19. And we're working closely with the labor agency, not only on how we implement AB 2034 and convey the information that it requires, but also how we can work on worker trust, because we understand that that's a critical gap that we need for workers to not only have the information, but they need to trust the institutions, and we need to deliver, of course, on those promises. They need to trust the institutions so that they will report, so that they will act, so that they will exercise their rights, because they're, of course, the people that have the most at stake when it comes to their own health and safety. And as I address the third strategy, which is strategic enforcement, I just want to kind of tie that together with outreach. and the issue of trust. We've been overwhelmed with complaints. We've had 13,000 complaints since February 1, which is more than we typically have in a year. However, we've only had 149 complaints in agriculture, and that includes food processing, that includes meat packing. So that makes it the only industry where we've actually done more inspections than we've received complaints. We've conducted 286 inspections in that sector as part of our strategic enforcement, and that's in part a reflection of our emphasis, but it's also a reflection of how reluctant workers are to step forward, how they might not be aware of their ability to step forward, and of course this important trust issue, which we understand that we as a government need to focus on, and it's of course been exacerbated by federal policies over the last 4 years. My third point was just on strategic enforcement, how we've tried to focus our resources on areas like healthcare. Our highest number of inspections have been in agriculture. We've opened almost 50 inspections in food processing and meat. Well, in food and meat processing. We've opened over 100 inspections in the grocery industry out of the 1,500 that we've conducted. And so we have endeavored to focus our resources on those areas where we believe workers are most at risk. I think, and then finally, we've worked closely with the state task forces in Imperial County, in the Central Valley, not only doing outreach, but strategizing on how we do consultation with employers and how we can do target enforcement, especially in partnership with other agencies like ABC, the Labor Commissioner, Barbary and Cosmetology, and others. So I'll end there and make sure there's time for a few questions.
Thank you very much, Mr. Parker. Doug Parker, the Chief of Cal OSHA. And we will, that concludes our final panel, and we'll defer to the members of the Latino Caucus for some closing remarks and some questions. And Senator Durazo, I think just to allow us to conclude our briefing here in a timely fashion, we'll combine any questions with this final panel and also at the same time encourage you or your colleagues to make any final remarks as we wrap up our briefing. Does that work for you too?
Yes, maybe we could have the other members, I could be the last one. So
yeah, absolutely. So any questions for this final panel?
Yes, members, questions and comments, please combine them so we won't come back around. Ready? No?
I did have a comment primarily for Chief Parker. It was a pleasure hearing you speak also yesterday at the labor informational hearing on the COVID impact in our labor force. And I did want to mention that there are a number of openings at Cal OSHA, and I think that we should have more Spanish-speaking people apply for these positions. So I put that out to the rest of you. One issue that came up yesterday is that most of the inspections it's not so much an inspection, but it's rather letters that are going out to these employers telling them there's been a report that there is a violation. Increasing the in-person, I know that Chief Parker, that's something that your department will be working on in the future, because those in-person inspections are extremely important. When our workers finally get the nerve up to say that there's something wrong and that needs to be reviewed, doing the in-person inspections are extremely important. But I do want to thank you. I know that you're fairly new to the position. Count on us. We want to empower you to make sure that everything that you feel needs to be done by Cal OSHA is done, especially for our most vulnerable and frontline workers, who we're talking about here. So thank you once again. And Chairwoman Durazo, thank you so much for partnering to put this panel together, this entire conference together. Thank you. This has been very, very informative. Thank you.
Assemblymember Gonzalez.
Yeah, I also want to echo that. I want to thank you, Chairwoman Durazo and Vice Chair Rivas, for putting this together. It's clear, I think, after all we've heard today, that so much of our focus has to continue to be in the workplace. I think in every single panel we heard about Latino workers. And that's, I think, so often forgotten about as we talk about dense housing situations and health disparities. At the end of the day, we have Latinos going to work and we've done our best. And I want to thank, of course, Assemblywoman Reyes and some of the bills we passed last year to give the administration the tools to help with this. And so thank you to all the union leaders and folks who are doing this every single day together. I think this is not just a COVID crisis. The crisis with Latinos in the workplace extend beyond COVID. We're just seeing the worst of it, I think, because of this pandemic. So thank you for highlighting that. And we have a lot of work to do. And I know this group is all set to do that. So thank you again.
Great, thank you. Anybody, Assemblymember Rivas?
Sure. Yeah, I couldn't agree more with my colleagues. And, I really appreciate all the time that was taken by our panelists. All of this information was so informative. Clearly, as a legislature, we have a lot more work to do. And that's why your information is so critical, so important to that work that we have to do as we move into a new session in a little less than a month. So again, thank you for your time. It was a great discussion and look forward to working with you all.
Madam Chair, I am so sorry. If I may just add, we were joined by Dolores Huerta, who is also listening in, and I'm just so proud to have a leader like her joining with us, and wanted to acknowledge her continued effort in making sure that we protect our workers. So I just wanted to comment on that. Thank you.
Welcome, Dolores Huerta. Thank you for joining us.
Yeah, I'm sorry we missed her. I'm sorry if she's still on. She'd like to make some comments, but I too want to thank everyone. I think some issues were brought up, some of which we've heard before. Others, you've highlighted them. I know Castello has highlighted the issue of the actual access to healthcare, which is an underlying and a continuous issue, and especially the role of community clinics. I mean, you've taken it to a higher level, Castello, where it's not only healthcare access, but it's also civic engagement in order to get that, and the combination of the two. Angelica, with the work that you all did and other CBOs across the state to try to get some minimal resources into the hands of the Latino community. Evelyn, gracias a ustedes y todas las líderes de nuestra comunidad por tener el valor de organizarse y de ser portavoces por toda nuestra comunidad. Caitlin, you represent so many different communities of workers and industries that we talk about, but we just don't really know the depth of the impact. Chief Parker, I think if we listen to what everybody has said here, and I know I've been in other venues with you, we need you. We need you in a very, very significant way. We need you to raise this at a much higher level, the workplace issues, than what has been done to date. And whether you need the resources or whether you need to change or you need the legislation or you just need us to speak out. But when I heard Dr. Hayes Bautista talk about, we're not needy, we're not asking for something, we are essential to the future economy. That's a very different approach than, the pobrecitos, oh, those poor people over there, they always need this and they always need that. I think it's a whole different ball game when the issues of the Latino community are done through the lens of the state needs us, the economy needs us, not the other way around. But especially with regards to the workplace, there's no way to address the disparity without being much more decisive with our resources and a priority than to address the workplace issues. And with all due respect to outreach programs and ads and all that, that's not going to cut it. If you and I walk into a workplace, an ad isn't going to fix the problems in that workplace. Those workers are willing to put their lives on the line, but they are scared. They're scared of the retaliation. They're scared of getting fired. If they get fired, what access do they have? Maybe a food line is about it. Maybe a line to get a package of diapers, and that's about it. So I personally am depending on you to take a much higher role in this and to save the lives and to save this economy. So I think we could end there. Put it all on your shoulders, Chief Parker. No, I'm just kidding. We are partners with you, but especially because of the role that you play every single day. So, Brian, I think that's it.
Yes. Thank you very much, Senator. That does conclude our informational briefing on the subject of COVID-19 and the Latino community. So much food for thought, so much food for policy. Just to let you all know, a recording of this proceeding, of this briefing, will be archived on the Latino Caucus website and the Facebook page, along with any other materials that are shared by the panelists. So we encourage you to draw any one of your colleagues or allies who would be interested to the archive, to the recording, to review the briefing at their convenience after we conclude. And friends, that wraps us here. On behalf of the California Legislative Latino Caucus chairs, State Senator Maria Elena Durazo, and the Vice Chair, Assemblymember Robert Rivas, and all of the other Latino Caucus legislators, and all of our distinguished panelists, all of us socially distanced up and down the state of California. I'm Brian Green here from the state capitol in Sacramento. I urge you all to be safe. I wish you peace of mind and happy holidays. And thanks for watching. Take care.
Thank you, everybody.
Thanks very much.
Great job.
Thank you.